Hello guys, I'm THANESVAR here. So on behalf of my group members, I would like to share on how to conduct a CPR. So first of all, before we start a CPR rescue, so the first criteria we need to follow is we need to push hard and push fast. The first step is place your hands on top of the other and in the middle of the chest. Use your whole body weight to help the administrator for compresses at least 2 inches deep, and also delivered at least at a rate of 100 compression per minute. So 100 compression for per minute. And then the next step we need to use is to deliver our rescue breaths. So with the person head tilted back slightly, and also the chin must be lifted. Then pinch the nose shut and place your mouth over the person's mouth to make a complete seal. So next, the step we need to follow is we need to blow our oxygen into the person's mouth to get the chest rise. So I'll show you how to blow the person's in the mouth. So make sure the chest need to rise. So the next step is we need to continue the deliver 2 rescue breaths, then continue the compressions. Compression means the one we need to give pressure directly to the pump to the heart. So the next step is we need to follow the keep up the CPR steps for followingly. Then we need to keep up the cycle of the chest compression, and also the breathing. Our breathing we need to supply to them. Then until the person exhibiting signs of any signal of he life or he breath again, and also we need to wait for our medical responder to use an AED, and also if at the end of the cycle we may need to stop our CPR. So if the situation become unsafe to the patient, and also we cannot also continue our CPR or cannot performing our CPR due to exhaustion. So this is how we need to conduct a CPR activity for a patient. So stay tuned guys, next we going to do a podcast with my group members. Stay tuned guys.
Yes, hello to our lecturer, Miss Haja, and our fellow students. So, we are from IUH group. So, today we're going to talk about what is CPR actually. We're going to discuss about what is CPR actually. So, before we enter to the topic, let me introduce to my group members first. So, Jonathan, SHAFERUL, TANUSH, THIVANRAJ, FARIS, and THANESVAR. And my name is PRASAANTH. So, today. So let me start with what is CPR first. So cardiopulmonary resuscitation is a lifestyle technique useful in many emergencies, including a heart attack or near drowning in which someone's breathing or heartbeat has stopped. So let me ask Tanush. So Tanush, what is AED actually, Tanush?
So an AED, or we call as the automated external defibrillator, is used to help those experiencing sudden cardiac arrest. So it's a sophisticated yet easy to use medical device that can analyze the heart's rhythm, and if necessary, it will deliver an electric shock or for defibrillation to help the heart re-establish an effective rhythm.
Okay, thank you so much, Tanush, for your explanation. So let me move on to Jonathan. Jonathan, what?
The step to use AED is turn on the AED and follow the visual or audio prompts. The second, open the person's shirt and wipe his or her bare chest dry. If the person is wearing any medication patches, you should use a glove to remove the patches before wiping the person's chest. Third is attach the AED pads and plug in the connector. Then the following steps will be done by FARIS.
Okay, and the fourth, push the analyze button and allow the AD to analyze the person heart rhythm. Then the sixth is if the AD commanded that deliver a shock to the person, make sure that no one, including you, is touching the person, and then tell everyone to stand clear. Once clear, press the shock button. Then the last one is begin CPR after delivered the shock. Or if a no shock is advised, begin CPR, perform 2 minutes about 5 cycles of CPR to continue to follow the AED prompt. If you notice obvious sign of life, discontinue of CPR and monitor breathing for any change in condition. Okay, next. Proceed to the TANUSH.
Okay, thank you so much, Faris. So let me ask Taneshwar. Taneshwar, when to use CPR?
So actually, there's a situation that when we are when the need of CPR arises. So the first of all, if the person they are not breathing, so it's the time to perform a CPR to circulate the oxygenated blood through the body. So without the blood flow and oxygen, so the heart stops beating, and also the brain start dying. So without blood flow and oxygen, the heart will stop, and then also the average person can only go without oxygen for a total 6 minutes before it's like a, how to say, it's like a damage is done to the brain. So what I'm trying to say is, if you start CPR within the time frame after the cardiac arrest, there is a hope. There is a hope the person will survive without much brain damage. So next, I would like to invite T1 to explain about another situation when to use CPR.
Yeah, it's they take occasional gasping breath. When someone goes into cardiac arrest, they may continue to breathe for if they start gasping for breath, and CPR compression should be start right away. Next, I will pass to SHAFERUL.
Uh, if you cannot feel a pulse, begin performing CPR. If the heart is not pumping, oxygen is not getting to the rest of the body. Chest compression keep blood flowing to the heart and brain until emergency responders can take over and try other methods of resuscitation. It is recommended that you begin CPR if the person is unconscious or unresponsive. If their condition becomes unstable because you don't intervene, they may lose control of their breathing. Okay, next, Steven.
Yes, SHAFERUL. A person who heard stop from sudden cardiac arrest must get help within 10 minutes to survive. Breathing is usually the first sign of sudden cardiac arrest. If you think someone may be in cardiac arrest, try the following steps, which are: it is if you see a person faint, or if you find a person already unconscious. First, confirm the person cannot respond. The person may not move, or a movement may look like secure. And second one is you can shout at or gently shake the person to make sure he or she is not sleeping, but never shake an infant or young child. Instead, you can gently pinch the child to try to wake him or her up. Next, I pass to Faris.
Okay, and then check the person's breathing and pulse. If the person is not breathing and has a no pulse or has an irregular heartbeat, and then prepare to use the AED as soon as possible. Okay, next to pause back.
Okay, thank you guys. Thank you for your explanation. So online training to the employees can allow them to know about the proper procedure for assisting victims of heart attack patients. They will know about the correct knowledge for carrying out emergency situations. The employees will learn about how to handle medical emergencies at the workplace without panicking. So I'm gonna ask Jonathan. Jonathan, how we gain confidence for this by learning CPR actually?
We gain confidence by learning about the CPR. Employees will not feel afraid in case someone suffers from a heart attack. They will become more confident in handling emergency situations. It will allow them to provide timely assistance to the heart attack victim, saving the life to other co-workers. When employees are confident in performing CPR, it will help them easily manage the emergency, and training offer the vital knowledge. Next is SHAFERUL.
Okay. An important component of employee productivity is the morale. When the morale is high, the team productivity increase. Providing CPR training to the employees will give the indication that the company is concerned about their welfare. Ensuring health and safety environment will ultimately lead to enhanced well-being, resulting in the improved morale of the employees. Next, Tanush.
So for the benefits of AED, so when it comes to looking at the potential benefits of defibrillator, it is crucial that you also consider the risks that come with using these devices. So the great thing about these devices is that an AED device is usually considered exceptionally safe. Sure, the device delivers a shock to the patient's chest. However, the specific mechanism that lies underneath the procedure was developed to ensure that harm will not come to the patient when the product is used appropriately. So the system guides the rescuers through the entire procedure, ensuring the safety of both the patient and the person conducting the defibrillation. So next is the conclusion for THANESVAR.
Okay, guys, in my conclusion, guys, so providing a CPR on time, so actually we can triple the chances of person surviving ratio apart from heart attack. So, however, the importance of providing the CPR training to the employees is very often overlooked in every organization. While most corporations and companies they provide training to reduce the risk of injuries and accidents on the job. For example, it's like a CPR training. It's usually it's not considered of so many companies. So, Prashant, can you give a justification about a CPR and AED?
For the conclusion. So from my side, I'm going to finish. I'm going to finish about this lah. So, however, the reality is that CPR training to employees is vital. Of the 220,000 heart attacks that occur every year in Malaysia, around 4 or to 5% happen at work, according to the Occupational Safety and Health Administration. Providing CPR training to the employees can offer various benefits. Here are three main benefits of offering first aid and CPR training to the employees. Thank you so much for your explanations and and discussions, guys. So I think so. After this, everyone need to be learning basic CPR things. Not only doctors. We need to learn to save some lives as well, and our life will be saved by someone, even doctors or somebody. For the conversation and discussion. So peace out. Bye.
Thank you, everybody.
All right, thank you.
Thank you, guys.